Good evening, ladies and gentlemen. It's just gone 1:30. We have 60 people present. We may have some more joining, so I'm going to ask my colleague Carole Whittle if she'll keep an eye out for admitting anyone else who wants to join us. I am recording this session so that we can post it via YouTube to carers who wanted to come this evening, but we've run out of space. I'm very pleased to welcome Jim McManus to join us this evening. Jim is the Director of Public Health at the County Council. He's also the Vice President of the Association of Public Health and an honorary visiting professor at the University of Hertfordshire. I think it's fair to say that Public Health has coordinated this county's response to the coronavirus, working not only with the County Council and the District Councils, but also with all our health colleagues in the different trusts. It's a small but active team, and it's had a very demanding time. And I can only assume that now that part of the county has gone up into Tier 3, Jim is very pressed. And so I do appreciate him joining us this evening and giving his time. He's accompanied by two colleagues, Anna Makepeace, who introduced herself to some of you earlier, who also works at the county and who is the Frailty Programme Manager. And I think we're expecting Tom Hennessey, who's the Assistant Director for Health Integration across health and social care in the east and north of the county. Briefly, this evening, Jim is going to go through a presentation which talks about what the coronavirus is, how it's spread, what the vaccination is and what it hopes to achieve. It talks a bit also about the prioritisation of different groups in the community. And I know that that's been the subject of questions that many people have put in. We are then going to go on to questions. We have about 50 odd questions which we can show. Jim has had sight of them. Some of them may be covered in his presentation. Where we're not able to get through all the questions, we will ensure that we have written answers so that we can provide those questions and the written answers to everyone who's attended this evening. So can I hand over now to Jim McManus?
Thank you, that's very kind, and big thanks to all of you for joining. I know that...
You're mute, Jim.
Oh dear, sorry. So I'm good at doing that. Some people think it's best when I'm muted. Firstly, a big thanks for coming along this evening, folks, and for all your questions, and a very warm welcome. And thank you for all that Carers and Hearts doing for arranging this. And can I also say a big thanks to Anna and Tom, who have really done, gone above and beyond the call of duty in the work on keeping our care homes safe, as well as whole loads of other work during this pandemic. And, I can often get emails from Tom and Anna at 8 in the morning and still get emails from Tom and Anna at 11 o'clock at night. And we know what it's like to work long hours, as do many of you actually caring for people. It's been a long haul. I'm going to do a few slides, if Zoom will let me. And then I'm going to go straight on to questions. So I'm just going to try and share that and then go into slide share mode. So tell me when, somebody please, when you can see the slideshow. And I can see Tom eating a yogurt. I'm jealous.
We can see your screens, Jim.
Fabulous. Right.
If you want to click on from beginning.
Oh, done. Can you see it?
Yeah, but not the show. If you click on from beginning in top left, we'll see it in full screen.
Done. Hang on. Right. Okay. How's that?
That's it.
Yeah.
Right. Grand. Okay. Sometimes works and sometimes doesn't, this thing. Right. So I'm going to talk about the vaccine and what's happening and some basic information. You can have these slides, and I've pasted these two websites in the chat. The top website is the main NHS site that answers all sorts of questions on coronavirus, including what's in it. And the bottom site is the local Herts and West Essex care system slides, which give you information more locally. A few key points I want to make. The first is that the vaccine is free. Nobody is going to be expected to pay for it. if you are ever rung up and asked to pay or for your bank details or anything else, it is a scam. The NHS will call you. You will not be asked to pay for this vaccine. That's a really important thing to get across. You will not be asked to pay for it. And one of the things to mention is that we have never in the UK, in fact, anywhere in the world, managed to achieve population immunity to a virus without having a vaccine. Even the 1918 Spanish flu was circulating, still circulating ancestors of the flu virus now. And without a vaccine, we've never achieved population immunity. What happened with flu was eventually it mutated and other strains came in. But if you look at viruses like hepatitis A and hepatitis B, there is no population immunity to those. We need a vaccine. And coronaviruses, which are the group of viruses from which COVID-19 comes, if you like, is a vaccine which most humans don't have immunity to this vaccine. But there are 7 or 8 other coronaviruses that have been circulating for a while. And some of them we've developed immunity to, but many of them, most of them, we haven't. This graph shows you the figures for the east of England, and you can see, and this is just the last month. So on the 27th of November, 28th of November, you can see that it begins to rise. We're still in lockdown on the 27th of November, and the virus has actually risen significantly and rapidly since we came out of lockdown on the 2nd of December, but already started to rise while Hertfordshire was still in a lockdown. And you can see that the lockdown actually dipped it a little. And we're sharing this pattern with almost all of London and the east of England. The virus is moving very, very quickly in London, the southeast, the east of England, almost everywhere, especially in London, partly being fueled by London. And if I showed you this graph, and I realize this graph is difficult to see, but it basically gives you all the local authorities in the eastern region of England, including Essex, Cambridgeshire, Luton, and so on. And you can see that the thick dotted green line, kind of in the middle of the pack of lines, is Hertfordshire. But look at Thurrock, way up at the top, very, very high. Look at Southend, very high as well, the one underneath it. And then look at Luton, the yellow line, which has been consistently one of the highest all the way along the lines. This basically shows you very clearly that everywhere has risen. And if you took out that Thurrock line, everywhere would look a bit like that Thurrock line, just a wee bit smaller. So everywhere has risen. And here's Hertfordshire, the 10 districts in Hertfordshire, and at the top is Broxbourne. But you can see below it is Watford, still rising, just not as dramatically as Broxbourne. Below that, you've got Hertsmere, still rising. And below that, you've got Three Rivers, but everywhere is showing a rise, more or less, with the exception of Stevenage, which is rising, but at a much slower rate. Now, in terms of transmission of this virus, and to give it its Sunday name, it's called SARS-CoV-2, so SARS coronavirus 2. Severe acute respiratory syndrome coronavirus 2 is its full name. It's really spread by aerosols. In other words, when you breathe out particles or cough out or sneeze particles suspended in the air, usually less than a meter between people. And that's one way of spreading it. The other spread is direct contact with droplets, either because someone coughs on your face and you get a droplet, or actually coughs on a surface and you touch the surface and then touch your face. Those are the ways it really infects people. And the points of entry into your body are really your eyes, your nose, and your mouth. So all these people wearing the masks on their chin have not invented a new way of getting the virus across and protected it from themselves. They're actually wasting their time wearing masks, if you like. I'll skip this slide for the sake of argument, and I just want to talk quickly about something that we call the Swiss cheese approach to viruses. And its posh title is combination prevention. But basically what it means is you take a series of things, each of which have a series of holes in them by themselves, and stack them up. And the virus might get through one or two holes, but actually, if you add enough of them, sooner or later, you'll stop the virus. And that's why they use Swiss cheese, because it's a bit of an analogy that if you look at malaria in the 1950s, we used the Swiss cheese approach very well. So the first slice of Swiss cheese was draining swamps. The second slice was mosquito nets. The third slice was quinine. The fourth was insecticide, and so on. And if you added all of them up together, most mosquitoes didn't survive to pass on malaria to people. Well, it's the same with COVID. You keep your physical distance, then you wear your mask when you have to, and if you're able to, then you have good hand hygiene of sanitizing them, and don't touch your face outside unless you've cleaned your hands first. Then you kind of limit your time in crowded areas and so on, and add all of them up together, and the virus will find it very difficult to spread to you. And the latest slice in the Swiss cheese, or the latest line in the armory, if you like, is now the vaccine. And that will really work, but it will take some months before we have enough people with enough immunity for this vaccine to really stop spreading. So bear in mind that you have to have 2 doses of the vaccine 28 days apart, and then you have to give it a couple of weeks to really work. So we can't give up these things like keeping our distance, wearing face coverings, washing our hands, and limiting social contact for now. We have to keep them going until the vaccine has done its job, and that will be some months. It will be after Easter. So in terms of how vaccines work, well, basically vaccines make your body think it's been infected. And that usually means your body will react to it. So if you've had a TB vaccine, you might get a lump in your arm if you've been vaccinated in your arm. But if you get a flu vaccine, you might get a wee sniff. A lot of people think the flu vaccine gives you flu. It doesn't. Quite often what happens is either you get a reaction to the vaccine, or you pick up another virus that's circulating at the same time, around the same time you get vaccinated. So vaccines make your body think they've been infected, and that's in order to get your body to mount a reaction, so that when your body's presented again with the infection that the vaccine protects against, your body will recognize it and stop it. This is a picture of the culprit, SARS. So basically it's a kind of an envelope, if you like, of fats and sugars and proteins with a bunch of, so that's the gray bit, with those red spikes are just surface proteins that enable the virus to lock into your cells and infect it. And then when it gets inside the envelope, or the little ball disintegrates, and the genetic material inside the virus gets into your cell and starts to make more copies of itself. And the vaccine that has come out is actually a synthetic, so it's not live and it's not a full virus, a synthetic bit of the spike protein that your body can recognize. That's the Pfizer vaccine, not the Oxford vaccine. That's a very different type of vaccine. A lot of vaccines work on injecting either a weakened form of the live virus into your body, or a dead form of the virus, or they inject a completely different dead virus with the genetic material for the thing you're being vaccinated against. Those vaccines are not yet ready. The Oxford one is the nearest. This vaccine is a completely new type of vaccine that's been in development actually for some years, the technology, which is why we got here so quickly on coronaviruses and in cancer, and it uses a bit of the spike. So at no point does this vaccine actually give you any actual real live or dead virus. The government's decided the vaccination priority criteria. So we can see that the first criteria are older adults in a care home and care home workers, and some frontline NHS staff, and people over 80. And then it will move progressively down the age groups until it gets everyone over 65 done. Then it will do high risk adults. Then it will do moderate risk adults over 65. And then they'll eventually come down until the rest of the population are done. If you look at those, the very top priority groups, if you add together people over 65, NHS workers, social care and care home workers, and people with who are over 50, who've also got, ongoing illnesses, and BAME people who are vulnerable, you're looking at 22 million people. That's going to take a bit of effort. So that will take a wee while to get to you. I've had cancer, as many of you know, and I'm in a priority group, and I have the great privilege of being 55. So I'm in group 9. I will go and get it when I get it, but until then, I will take every measure I can to protect myself. And that's the end of the slides. So I'll stop there. You're very welcome to have these slides, and we can go to the questions if that helps. And Roma, are you comparing us through this bit? You said hopefully. You cheering us and telling me to shut up.
I'm hoping to show you the questions now so we can go through them. These questions have come in the order they were presented by carers. There's going to be a lot of questions in this, Jim, I think you're going to have to address about our carers, and we might actually do it first if you don't mind, because people keep asking, what priority will unpaid family carers get? Will unpaid family carers be treated the same as social care staff in terms of getting some priority for vaccination? Because a lot of people are asking that question.
Tom or Anna may know better, but the latest information I have is that government hasn't decided to do that because they've prioritised the people who are most likely to die from getting the virus, either because of their condition or because of if they get exposure, if that makes sense. So we can lobby for that, but the priority, they had a choice of protecting all the younger people who circulate widely, or protecting staff, or protecting people most likely to die. And they went for protecting people most likely to be seriously ill and die. And my own personal view is I think they should have done unpaid carers. And we can lobby for that priority if that is what people would like. But they've made that decision, not us. It's not something we had any power over.
Thank you. Shall we then go through the questions? I mean, and the first one relates to people with learning difficulties who don't do well with needles. We do know that when some people are eligible for the flu vaccine, this is a spray up the nose or something similar. Can you give us any information about what provision might be made for people who are going to find it very difficult to have a needle vaccination?
So this vaccine can only so far be delivered by means of a needle because of it is a very fragile bit of RNA, a bit of genetic material, and if you just put it straight into your body with a protective envelope around it, your body would kill it. So it needs to go in as a protected way and injected in the way it is injected. So as yet we don't have a spray vaccine like we have with flu, Whether that will come with the other vaccines is something that they're still working on and still planning for. But at the minute, it is definitely a needle only. And I think that will be distressing for some people, but the technology just isn't there yet to deliver this vaccine in any other format. Depressing though that is.
The only other comment I could make is we do have the learning disability liaison nurses who may be helpful in that context. The second question was about people who are living in extra care housing or assisted sheltered accommodation for older people. The example is someone over 80, but given that care home residents may be a priority, what about people in extra care housing or sheltered accommodation? When are they likely to be offered the vaccine?
So people in sheltered accommodation will go strictly by age rotation down the priority list. So it will be people over 80 will go first, and then people over 75, and then people over 70. Now, the vaccination has started to roll out. The first people were vaccinated in GP surgeries this week in Hertfordshire, in GP practices. So they're already working through the 80-year-old population in the community, and as well as people in other settings. So I reckon that will be, if you're in extra care and you're in your 80s, you'll be called fairly soon. If you're in extra care and you're over 75, it will be just after Christmas, by my reckoning, with best guesstimate.
Can I also add in? I noticed the question, it talks about housebound. So yes. I know the GPs are working on a housebound model, and they've been working on that for a number of weeks. And I'm not a public health expert, but a lot of that is around how they can move the vaccine around people's houses. So I know they are working on that. I don't know if, Jim, you want to mention anything else around that housebound model that's being developed, but that is being developed to support people that are currently unable to leave their house for this vaccine.
That's really helpful. And I wonder if I might invite Anna and Tom just, if we do a treble act whenever you want to, and just butt in. The issue about so yes, we're getting to a housebound model. The issue about moving the vaccine is it's quite fragile. It could be stored for up to 10 days outside the deep freezers, provided you replenish it with dry ice. And then it can be stored for up to, I think, 5 days in a proper clinical fridge. So you can move it to housebound people, but it needs to be kept at that stable temperature. And the reason for the temperature is because the protective envelope the vaccine is in, when it goes into your body, you don't want your body to destroy it before you get into your cells. And the temperature sensitive bit is that protective envelope that wraps around the wee protein.
Going on to question 3, this is about, well, you can read it, adverse reactions, particularly for very elderly people.
So my advice is always to look for an adverse reaction of some kind when you have a vaccine. And if you don't have one, consider yourself lucky. So it's just that with flu, a lot of people have gotten complacent. And even with things like hepatitis B vaccine, people can get fatigue. And the kinds of adverse reactions you might look out for is, so those of you who leave your flu jab within 5 minutes, who shouldn't, the reason you're asked to stay for 10 minutes after your flu jab is in case you get a really fast temperature and spike and get an anaphylactic reaction. I know some of you will be familiar with that. It's exactly the same here. So that's the first thing, and that will usually come on within half an hour if it's going to. And I'll have to say the 2 people who had those severe reactions on the first day of vaccinations shouldn't have been anywhere near a vaccine, because a history of allergy meant they shouldn't have had it. Now that's very, very rare. So I don't want to scare you, but it's very, very rare. Reactions are very rare. Then the reactions most people will get will vary from feeling a little sort of feverish sometimes, a bit of a headache. Some people might get a little bit of inflammation at the site. Some people might feel tired for a day or so. There'll be 1 or 2 people who just feel like they've got a hangover. I remember hangovers. You know, I haven't had one in years, but I certainly remember one. And indeed, my oncologist said when he was in, he said he's had worse hangovers, and I just said that means he drinks too much. So that's the kind of generic reaction. There will be a small number of people who will have more severe reactions, but you have these with vaccines and they always get monitored of. So just be aware of that. If you're on anticoagulants, then just check with your doctor that you're stable, and then it should be fine. Because they can vaccinate people who are on anticoagulants. If you're immunosuppressed, so if you've got, if you're on regular methotrexate, check with your doctor, because for many people with autoimmune conditions, it's fine. For many people on methotrexate, it's fine. For some people, it isn't. So if you've got HIV and it's well controlled, vaccination's fine. If you've got most immunosuppression and you're well controlled, vaccination's fine. But there are 1 or 2 for whom it isn't. So you should be very upfront with your clinician about your health condition before you get it.
And you can see the second part of the question again is about unpaid family carers. If they're a sole carer for an elderly person, are they just simply going to have to wait their turn in terms of age at the moment?
Sadly, they will just have to wait their turn in terms of age. I mean, again, this is all decided by the NHS, and I can't influence this at all. But it's fair to say that the county council and the district councils and the voluntary sector have been doing an awful lot to help the NHS find vaccination centres, for example. But what we can do is we can lobby nationally, and I'll happily do that with you and for you, for unpaid carers to be put up the priority list. Because I think if I had a problem I could pick at with this vaccine, I would pick at sometimes the people who designed the priority list were not very well aware of the realities of people's lives in terms of having carers and in terms of, you know, being hesitant about the vaccine or having questions about the vaccine, you know, as in real life people.
Right, so the fourth question is about whether people are eligible for the free flu vaccination because they have an underlying health condition, not necessarily because of their age. Will they be entitled to the COVID?
Yes. So if you look at the list of priorities, it's basically it follows the flu. So anybody, if you're eligible for free flu, because, for example, you've had cancer or you have arthritis or diabetes, you will be eligible for the COVID vaccine, and you will be prioritized slightly higher than the rest of the population because you've got a long-term condition. So if you're 45 and very fit and very healthy and have no conditions, you'll be later in the queue than if you're 45 and have got diabetes. In fact, you'll be ahead of, if you're 45 and got diabetes, you'll be ahead of healthy 50-year-olds.
And you'll note the question again about people with autoimmune conditions and whether the current vaccination is the right one for them, or should they wait?
I think the knowledge that we have at the minute is that the genetically engineered vaccine is the best, although this is still developing and, you know, this could be different by tomorrow, is the best one for people with autoimmune conditions. But, you know, if you're on methotrexate, for example, because of arthritis, and well, you have my sympathies, because I had methotrexate for 3 months and it was not pleasant. Then ask your doctor. If you're on immunosuppressant drugs, ask your doctor. If you're on anticoagulation treatment and you're a bit unstable, ask your doctor. If you've got a history of allergies, ask your doctor. And that's not because the virus is unsafe, it's just because people with those conditions have a history of adverse reactions to vaccines that you just need to be clear about. And it may well be safe, but it's just double check. Ask. Don't be frightened of asking.
And again, this is another question about carers, and I suppose the same answer stands. But this is an example, of course, where perhaps the husband will have the vaccine, but he'll be restricted because the wife hasn't. But I guess if we can take this forward as a lobby, that's probably the best thing to do with it.
Yeah, and I think it's cases like this that the national system hasn't particularly thought through.
Yeah. Number 6, I think some vaccinations have started in Hertfordshire for the over 80s. Is that across the county?
Yes, so rolling out slowly across the county. One geographical area went first, and I can't remember which one it was now. But the vaccine has definitely started for over 80s.
It was in Stevenage, sorry, Jim. It was in Stevenage, so Lister Hospital went first last week, and it's now in some of our primary care networks. So we know some went live this week with our primary care networks. Some are going live next week. I believe we're going to have 22 sites in Hertfordshire delivering the vaccine. I'm just trying to remember my figures, 22 sites, but obviously a lot of this depends on how quickly the GP practices can set up logistically. It's not like the flu vaccine, they can't just turn up. So a lot of this is down to logistics and how quickly they can do that. But it's like wave 1, wave 2. I think we should be by the end of December, all 22 sites should definitely be set up, is our understanding.
And the next question, again, about someone who is clinically extremely vulnerable, possibly not well enough to have the vaccine. What can be done to protect her?
So, I mean, there's two things. One is if the person can't have the vaccine, they are looking at what's called antibody therapy and antibody treatment, which again will not be suitable for everybody, but that is very slowly rolling out from the NHS to people through their clinical care teams who are eligible for it. But if you are a carer and the person you care for is clinically vulnerable, I mean, the answer is until the vaccine comes along for you, you have to keep taking the measures that you've been taking to date. And I realise that's frustrating, but the government system has prioritised the choice it has, and consequently, there is no way of changing that without getting it changed nationally.
Thank you. And another question really about whether family circumstances will have any priority. And I think what you're saying is no, they won't.
No, I mean, I think it's not the most nuanced prioritisation in the world, but I think what we have to do is get stuck into the policymakers and work with them to make it a bit more nuanced. So if you've got a family where you've got 2 people who are caring for you, it makes far more sense just to vaccinate them at the same time once we've got the supplies up and running.
Perhaps we could have a discussion outside the meeting about how we would lobby most effectively.
Yes,
Yeah,
happily.
it's a big issue for carers. And again, we have an example here where we have a husband being cared for who's extremely poorly. We have a granddaughter with aggressive leukemia, obviously wanting to visit, but can't until they're both vaccinated. So I'm guessing that the husband would be called early because he is clearly very vulnerable. Metastatic lung cancer, open brain surgery.
Yes, I suspect so. I mean, if he's well enough to be given the vaccine, I mean the issue with so Great Ormond Street will be looking to vaccinate people who are very, very vulnerable and protect them. Obviously, you can't give a vaccine to somebody who's neutropenic, but the issue is how do we protect people who are neutropenic and after they've stopped being neutropenic and their white cells have started regrowing again to the point where they do have a bit of a functioning immune system. And it may be the case there that the option is Great Ormond Street may think about antibody therapy if they've got it, or it's a case of you continue to have to do the same kinds of things as if you were neutropenic until others protect you. A really important thing is that there will always be people who will be unable to have the vaccine. I think the cancer I had, after my last bout of being neutropenic, which was the fourth cycle of chemotherapy, I would have had to wait a year before I could have contemplated any vaccines, and I was still on kind of prophylactic treatment for pneumonia. So the key thing about this is those of us who can get vaccinated should get vaccinated, because it will protect people like that person's granddaughter.
Next one is very straightforward. Allergy to penicillin, would it be safe to take the vaccine?
It should be, but the science is being updated every day, and there's a thing called the Green Book that gives instructions to clinicians. So the important thing again is, if you're allergic to any drugs, tell the clinician, because as we know, there's a system being put in place to monitor reactions to this vaccine, and as we know more about them, the list of people who can and can't have it will get much more sophisticated. So tell your clinician, but from what I've seen, it's safe, and it shouldn't cost you at all to have the vaccine.
And you've already told us that no, there isn't, at the moment, the only option is to have a needle vaccination. And I'm presuming the availability is again around the priority list that is in your slides.
Yeah, they will work rigorously down that priority list until they change it.
A question about a vegan option.
So the veganfriendly.org.uk rates the vaccine as vegan friendly. There is no animal DNA in it, and the Vegan Society issued a statement saying that they thought it was acceptable for ethical vegans to take the vaccine. I mean, it's about as vegan as it's going to get. The vast majority of the contents are water. It's genetically engineered. It's much more vegan friendly than the Oxford vaccine. So if you're a vegan, this is the best option for you.
Thank you. Is the vaccine safe? That's obviously a question in a lot of people's minds.
Well, I think it is, unless you are, I mean, even the people who had the really anaphylactic reaction have recovered. So I think it's safe, because it's entirely synthetic, because it's not a full vaccine virus. It doesn't make your body replicate the full virus either. It just replicates bits of it. So I think it's safe. I mean, you'll have heard all these stories about, well, you know, it's making people test positive for HIV antibodies, and then people jump to the idea that it means it gives you HIV. It doesn't. It's just a kind of some of the spike proteins that an HIV test recognizes are not dissimilar to some of the spike proteins that this vaccine creates. That doesn't mean in any way, shape or form you've got HIV, for example. So that's just a quirk, and it doesn't make it any less safe. I think another thing that people often ask is about nanoparticles. Does that mean it's got a chip in it? And the answer is no. Nanoparticle just means a tiny, tiny, tiny particle of protein. And that's all it is. It's not even a full virus. So for my money, this vaccine will be far safer for now than a weakened live virus vaccine. And certainly when it comes my time to have it, I will roll my sleeve up and stand there gladly.
Thank you. I know Anna was talking about the fact it's beginning to roll out in Hertfordshire now. Have we got any idea of timescales in relation to the priority list? Because here we've got a question about someone in their 60s with serious physical disabilities. At the moment, as far as I can see, we're beginning to provide the vaccine to people over 80. Any feel for timescale yet?
So if you look at to vaccinate down from the over 80s to the population who are about 60, you're talking about if my sums are right, about 175,000-180,000 people until you hit the cohort of 60 to 65. let's call it 200,000 people for sakes. If we can vaccinate 22 vaccination sites, we'll vaccinate about 100 people a day each, so that's 2,200 people. They're operating 7 days a week, so that will be 22 times 7, and that's the point where I lose my calculator. So a week, so a day in Hertfordshire, you can do 2,200 vaccinations, and it will take you about 100 days to get down to the 60 age population. So you're talking early, middle February.
4 weeks, 4 months rather. Yeah. Okay. So again, we haven't really got a time scale here. We know that his main carer, the main carer in this case, who's looking after an 18-year-old clinically vulnerable son, would still at the moment have no priority beyond their age. So that's the matter for our lobby.
Yeah.
Can you comment on number 14, a specific one here, where someone's had a bad reaction to the flu vaccine? Should she abstain from using the SARS vaccine or the COVID-19 vaccine and wait for the Oxford one? Have you got any view on that? Can you advise us?
I mean, the Oxford vaccine is actually a modified virus, so it's a dead human adenovirus into which the genetic sequence has been injected. So I would say my hunch, and I'm not a clinician, is the Pfizer vaccine would probably be safer, and speak to your clinician before you take it. So when you're rung up or written to or called, tell them that you had the flu vaccine in the injection site. Now, the injection site could have been inflamed for a number of reasons. One is as a result of the vaccine, sometimes happens. The other is you might have just gotten a skin infection, and that's often what happens with vaccines, is people get a little bit of skin infection or a little bit of infected tissue, or there's a little issue with the needle itself. So there could be multiple reasons, and if it's just around the injection site being red, tender and swollen, my hunch would be that's more likely to be a localized reaction and infection at the site rather than the vaccine itself, because the vaccine would be more likely to give you wider symptoms. That could be an underlying sign of some other problem there. So speak to your doctor and give them details about this.
Sorry, Jim, can I just come in very quickly? It's I noticed in the chat that we're talking about, it is 2 doses, no matter what, whether it's a Pfizer vaccination or the Oxford one, you've got to have in 2 stages.
Yes.
So you've also got to factor in terms of the questions around how long is it going to take. It's a product of the sites coming on, as Anna was talking about. They're going to come on in various waves. So it's going to be the end of the year or early January for all 4 waves are with us. And it is also reliant on a steady and regular influx of the vaccination. So it's very difficult for us to say definitive times. So it's about bearing with us, but all efforts are being made to make this really complex logistical process work.
And if we were looking for information about timescales across the county, where would we find that?
After you,
sorry,
Anna.
I was going to say, I think it's probably very difficult for us to give you a very clear picture. I appreciate that's really difficult. So I think part of the challenge is I know we've talked about all the logistics. I guess the other thing is we don't know how many people are going to come forward for this vaccine. And it's I mean, we really want as many people to come forward as possible, but that will obviously impact on timescales because, the more people that come forward, the more kind of we've got to go down the groups. So I think it's very difficult. I think we've got to do lots of work around encouraging people to take up the vaccine. That's really important. And actually, I think until we're probably through wave 1 or through priority 1 and priority 2 groups, I think we'll have a sense of where we're up to. I also think we're going to get our health professionals, the speed of how we're delivering the vaccine will improve, because as people get better and people get through, I guess the other thing is we're through Christmas. This is probably the worst time for us to be trying to deliver a vaccine during Christmas. But we need to be mindful that some of those times during bank holidays may mean we're a little bit slower. because of that period. So I think maybe we need to just, I don't know whether Jim would agree, but probably need to kind of work through the first 2 phases, and then we'll probably get a sense of where we get to. I just thought that would be useful.
I think that's true. I mean, this is the biggest peacetime logistics exercise in over 100 years.
The next situation is put forward by someone who has got supporting a wife in a care home, and you will know the problems that has caused to date with people being unable to visit or having very restricted visiting. And what's being postulated here is perhaps carers being able to have the vaccine provided at the same time in the care home car park, for example. But I think you're going to tell us that that just isn't a possibility at the moment, because whilst it might seem a very good and helpful solution, until the government changes its priority list, that isn't going to happen, I'm assuming.
It's certainly a helpful solution and we can recommend it, but I'm sure Tom and Anna would say at the minute that's not going to happen, because, and also you do need 2 doses to have to come back again. It's a brilliant idea.
Yeah.
Side effects of the vaccine. Do we know anything about side effects of this vaccine, particularly for people who've got pre-existing conditions?
So the bulk of reactions so far to people who've had it, in terms of there's a thing called the yellow card system, which is the national regulator makes you fill in a yellow card if you give someone a drug or a treatment or a vaccine and they react to it. The bulk of reactions so far we've seen have been a bit of fatigue, a bit of tiredness, headaches. I mean, leave aside the 2 extreme anaphylactic reactions of people who shouldn't have had it, the odd bit of inflammation and various other things, and symptoms that are basically like a mild dose of the cold, or feeling a bit wrecked for a few days and exhausted for 2 or 3 days. So kind of like just feeling a bit washed out. I have no doubt that as this vaccine rolls out, there will be an array of weird and wonderful symptoms, because let's be honest, every vaccine reacts differently in people's bodies. And in fact, you can get those symptoms from people taking aluminium hydroxide, otherwise known as Gaviscon. That's the thing about the human body. It reacts to all sorts of weird and wonderful things, and I've got no doubt that we'll get more and more of them, but the bulk of them will be as manageable as many other vaccines.
Thank you. I don't know who Professor Van Tam is, but I gather someone heard that vaccinations are only going to be offered to people over aged 50 and above. I think you showed us the priority list. What about under 50s with complex healthcare needs or existing conditions?
Yeah, so Professor Van Dam is the Deputy Chief Medical Officer for England. So right. I should stand and salute when his name is mentioned, because I am at least partly accountable to him, as well as to the County Council. I guess again, it's another case of the priority list says if you're over 50 and have got pre-existing conditions, you'll come earlier than if you're just over 50. But they will work their way through the list. So as Anna says, if only 5% of the population who are over 80 take it up, they'll reach the younger population more quickly. But that would be a bad thing, because we want everybody to take it up. So we have to be prepared that this is going to be a bit of a marathon, not a sprint.
And so the same comment then about those with additional needs and younger people, and a backup who would be a carer. Again, we are waiting for a change in priority if anything's going to happen there. This was actually from an elderly carer whose wife was discharged home testing positive with COVID. The carer himself is in his mid-80s, so would be a vulnerable person. Any comments on that situation?
So my view would be, oh dear, yeah. I mean, it depends on whether I would take that up with the hospital. I mean, if they're infected with COVID and still positive and still infectious, that's an issue I would take up. It may be that they have tested positive, but the virus is no longer infectious and it's just an artifact. So I, without knowing a lot more, I couldn't comment. I don't know if Tom or Anna want to add anything to that.
Part of the discussions around, obviously the premise is always home first. However, if somebody is, if you need to go into a care home, then you have to go into a designated care home. We won't be putting somebody just in any old care home because of the risk of onward infection. If somebody can go home, the assessment should take into account the home setup and the needs and the risks that might present.
Okay.
As Jim said, it would be positive a long period of time, and it was the risks were so low then that might have enabled that that discharge. But the thing is, as Jim said, always is to phone, speak to the discharge team of the hospital if you've got any concerns.
Thank you, thank you. Well, we know unpaid carers currently aren't getting any priority. And similarly, they're not going to be higher up the list because they're carers. So I think we've had an answer to that. But little C there, the neurologist has stated it won't be safe to go back to normal even 2 weeks after the vaccine. I think you said vaccine 28 days, vaccine 2 weeks.
Yeah, and even then, I mean, so it will be the 2 doses plus at least 2 weeks after the vaccine until you build up enough immunity. And even then, actually, I will still keep limiting, you know, hand washing, sanitizing and stuff like that after I've had it, because I could pass it on to somebody else if I pick it up from a surface. So until there's enough of us vaccinated, we just have to keep these measures.
Thank you.
Roma, do you mind if I just bring in a question from the chat? Sorry.
Please do.
No, I just noticed that someone had asked whether care homes are going to have all their residents vaccinated with the Pfizer vaccine, regardless of age. I think their daughter is 43. Our understanding at the moment is it's also working in some ways on the age we've previously discussed. So in terms of care homes, it's older people care homes first, and then it will be the younger people. So the registration that's under 65. We're not sure, and we are trying to understand, and we are actually part of the group trying to encourage all care homes to be vaccinated. But at the moment, we've been told very clearly it's older people, and then it is learning disability. What we also understand that if you're an older person in predominantly a younger person home, you will be in the younger person category as defined by NHS England. But we are trying to work with NHS England to try and understand and be really clear as to how we do this. And our preference in Hertfordshire is that all care homes would have the vaccine regardless of whether their status is learning disability home or for younger people. But that is currently where we are today. I don't know, Tom, whether you wanted to add anything else at that point.
No, the only thing I wouldn't mind picking up, Anna, if you wouldn't mind, just there's also the issue of consent.
Yeah, so that's a really good point. So there is an issue with consent. So obviously with all of these vaccines, with all of the vaccinations we're talking about, consent and best practice is really important. So the individuals will need to consent. We have ran a webinar for care providers on Monday, which was recorded, and we'll run another one around consent. So it's really clear to our care providers and our care homes in particular how consent operates. They do this all the time, but we have just reminded them, because ultimately it will be up for the individual if they have capacity to be able to make that decision. And we are really strongly trying to ensure that that is followed by issuing guidance. The county council has written specific guidance, and we are doing as much to kind of educate our care home managers who are already very well affair with this, just trying to help sure that we're going through that correct process.
Anna, there's a wee question in the chat about what if the individual doesn't have capacity.
So I think that's then maybe Tom, I think that's about mental capacity and the best interest decision. So that's the process that they would currently follow, that they would normally follow for flu vaccinations and everything else.
That's correct.
Another question here from a household where wife has dementia, Alzheimer's, daughter has Down syndrome. What priority are either of them going to get? I guess again it relates to age.
Yeah, again, it relates to the age priority. That's what government says. Age and pre-existing conditions priority.
And with type 2 diabetes, is there any priority there?
Yeah, so you'll be prioritised above your age as someone who has you know, pre-morbidities, if you like. So you'll come in the category of either moderate or high risk adults. If you're under 65, you'll come in that category of moderate risk, so that will be group 7. If you're over 65, you'll be in category 6, I reckon, with diabetes. Depends on how well controlled your diabetes is.
I mean, again, I think this is the pain people are experiencing, not being able to visit, and how difficult that is, and having to shield so they can't get in to visit. So the question is, if there's an urgent need for an early vaccination, is it possible for a person to be pushed up the queue in order to get vaccinated more quickly? And I'm guessing what you've told us already, that actually the priority lists are the priority list and there isn't any discretion around them.
Yeah, and I think it's, if you're under the care of a hospital doctor, this thing is such a big exercise that I haven't said this, but I suspect there will be clinicians in hospitals who are able to find people gaps in the vaccine queue. So it's always worth, if you really are in that circumstance where you're really under the regular care of a hospital doctor, it won't work with most people, but that might be something worth trying. But they're going rigorously through the priority list of the age groups, and there's no kind of priority list that's going to work for people perfectly. This is such a blunt instrument, this priority list. So the issue will be, until then, what can you do? I mean, I haven't seen my mum since January, and I find that very, very hard. So until then, speak to the care home and look at what is possible, because Tom and Anna and I have worked on care home guidance to try and make visiting as safe as possible, so they can facilitate visiting with PPE. We will be bringing on board testing for care home visitors in certain places. I am still right on that, haven't we? We haven't changed our minds on that.
No, so we still have that, and it's rolling out. All the homes across Hertfordshire should have the kits by Friday, is our understanding, for lateral flow testing.
Could you tell us a little bit more about that? Because that's of interest to a lot of carers who are here today, the issue of testing in the care homes.
Yeah, so from my very, very little public health, so Jim is probably going to have to fit in around the test. So what's happened, you'll have heard in the news, the government has announced that testing is now happening to enable visits in care homes. What the testing they're suggesting is lateral flow testing. So it's not the current testing that has to go away. We wait for 2 days. That can get your result in around 45 minutes. What has to happen though is each care home has been given a set number of tests, and it's being rolled out by Department of Health. And essentially the tests are to enable visitors in care home with touch. So it's up to a care home whether they want to implement it. It is completely up to them and all those discussions. But you can be tested and you have to go in a specific area. So it's quite dependent on the area of the home, whether they've got the capacity to do this and making sure they've got logistics. But essentially the person can get tested. I think it's a nose and throat type approach again. And you can go in and you can then have touch. What you need to be really mindful of though is you still have to follow PPE, infection control measures, social distancing as much as possible. So this doesn't mean that we're letting go measures. It's another way of trying to enable them. Now, if the home chooses not to do lateral flow testing or it isn't an option because of logistical, there are other options. So you can still have indoor visits with the Perspex screen or outdoor visits. We appreciate that's really difficult. In terms of the testing, the way that the care homes are getting it is being led by Department of Health. They're being delivered to the home and then they have to undergo testing, training before they can use it. So it's not that they can arrive and suddenly implement it. They do have to undergo some training. So they're a little bit reliant on the Department of Health sending them an email, which they have to then get, and then training their staff at a time when it's quite difficult. So I know some of the homes are working through the logistics now, and some have implemented it. But I think bear with some of the other homes, some of the smaller homes, this is getting really challenging for them. But they are working through it. We've also delivered iPads to every care home. So throughout November, every single iPad in Hertfordshire was given, every single care home in Hertfordshire was given an iPad. So actually where these visits aren't possible, you know, these really horrible situations where visits aren't possible, we've given them more equipment to support some of that kind of virtual conversation, which we totally appreciate is not the same, but we're trying our best in what is a very difficult situation. I know there's lots of questions around the accuracy of tests, so I'll bring Jim in, but just to say, if the home currently has 2 or more cases, you cannot visit the home. So we've continued with that policy. However, you cannot visit the home for 28 days. However, a home can appeal that decision. So if they have 2 or more cases, we do ask that they stop for non-essential visitors. And that's a horrible term, but what we mean is the non-health professionals. So people visiting, we do ask for them not to come, but the homes can appeal to the county council and they can reopen before 28 days. What we do is ensure that we have enough confidence that that home is then not going to risk the visitors picking up COVID, but also I guess further kind of concern within the home. So we have got that process and we've had that policy for a few months, and we know an awful lot of homes that have had outbreaks the last few weeks are coming through it, and we're responding to the appeals as quickly as we can, usually within 24 hours. We are working with the homes to try and open these homes up as quickly as we can at the moment, given the closeness to Christmas we're in.
Thank you. Thank you. Another question here, making a good case for carers to be given some preferential treatment. So perhaps we can use that for our lobby. And again, I suppose it's where you are providing personal care to someone you look after in the same way a social care worker might, but nonetheless, you're not going to have any priority.
Yeah, and I think it's going to be the same for people who are paid, for people who have what money we call personal budgets or direct payments. You know, that where you employ someone as a direct, to care for you. I think I'm not entirely sure government understands the nature of unpaid care or the nature of the lives of people working in social care directly employed, but then that's nothing new. It hasn't in the past 40 years.
There is a question later on from a mum who's got care workers coming in, a team of 5 care workers coming in to support a very disabled child at home. Now they are domiciliary care workers. Will they be entitled to the vaccine in the same way that residential care workers will?
They'll be on the list as health and social care workers, so they'll be in priority group 2.
Right. That's helpful, thank you.
Last time I looked. There's a couple of questions about lateral flow tests. I don't know if you want to ask those, because there's a question there about, so the accuracy of lateral flow tests varies by the level of training of people who take them. So they can be up to 80% effective and more. They can be as low as 50% in some circumstances. And as Tom has said in chat, actually it's not a panacea, but it's another layer of protection. And we've been rolling out training locally to enable them to get up to the top. But there's a question there about, are the lateral flow tests for care homes for younger people with learning disabilities too in homes? And I don't know if Anna or Tom.
It's to all care homes. So that's our understanding. It's all care homes should be receiving them.
Thank you.
But as Anna, I think may have said previously, we know not all care homes are using them currently at the moment, but they've got until Friday to be trained. There's an expectation all care homes will be trained by Friday.
I think they're receiving the tests by Friday. The expectation is it could go into next week. It depends on when they receive the email.
I understood from when I went on the training last week that they were expecting everyone to be trained by the 18th, because they should have had the kits by then. But as that's just another example, it's very difficult to be hard and fast with any times and dates. things seem to move on a regular basis.
Yeah, so oh, sorry, after you, Roma.
I was just to confirm though, you would expect that to be the situation next week.
Yes.
Yeah.
And to answer a question in the chat, a lateral flow test is basically the same as a rapid test. It's one way of doing a rapid test in under an hour, about 45 minutes, as Anna says, for testing for the presence of the virus. And it looks like a pregnancy kit, except as Anna says, the swab goes up your nose or down your throat. So you don't do with the lateral flow test what you do with the pregnancy kit. And you need someone to administer it for you unless you've been trained.
Thank you, that's helpful. I'm afraid we know here that carers aren't going to get the vaccine at the same time. Here that you've got someone who's housebound. Again, I think you said, Anna, that the GPs are working on how they're going to provide for housebound residents.
Yes, they are. I think, as Jim explained, it's to do with the fragility, if that's the right phrase, of the vaccine. So it's a bit more tricky to do housebound, but they are working on that. And it will either be through your GPs or through your community providers, so that's your district nurses. Will be doing that, but somebody will contact you when it's the right time. But I know they're working on that model at the moment.
I guess if someone's 100 and housebound, she should be fairly high up the list.
Yeah, you would hope so, yes. I think they're pulling together those lists now to try and support some of that, yeah.
And can we comment at all on someone who's shielding, extremely vulnerable? Any idea when they might be coming through for the vaccine? We haven't got an age here.
So if you so let's assume that they're over 65. They should be in the first half of those vaccinated. So well before Easter. If they're under 65 and shielding, they should be in category 6, which will be around about Easter time, we think, if it all goes well, possibly slightly later.
Thank you.
But again, it's very difficult to put an exact time on this.
No, I think we can see it's some time ahead, really. Testing here. Someone who's going to be looking after her mother over Christmas, is there any way she can be tested to see if she's safe?
The only way probably is to get a private test through one of the companies like CityDoc or Randox or one of the others if you want to have a confirmatory test. I know that there are people who have said that they've had symptoms for COVID when they haven't, and have got a home postal test that way through the national system, or indeed through the testing system. Of course, I couldn't possibly advise people to declare something untruthful on a national system to get a free test to save them paying £130 for a private test. If we had mass community lateral flow tests, they could easily get one of them, but that if they're desperate to get a test, they can go private, or some people, as I say, have gone on the government website and booked a test and said they've got symptoms when they haven't.
Okay, thank you. We are recording this.
I mean, I've said I don't recommend that and couldn't possibly recommend it. So yeah.
Again, you talked about, and obviously someone's 91, we'd be expecting them to be high up the list and something to be happening there pretty soon. But for an unpaid family carer of 59, I'm afraid they're going to have to wait till they get down to the under 60s to be vaccinated. Yep. Care in the home. Yes, so care homes are being prioritised, but people living at home, it would be a question of their age and their vulnerability. Thank you. A query about whether the vaccine can cause infertility. Is there anything behind that, or is that just a concern and a myth?
I think that's a bit of a concern and a myth. And one of the problems with the comms about the vaccine is it's been very tightly managed nationally, but what they haven't done is an awful lot of stuff of addressing fears. And I always treat every question about a vaccine as being a real and legitimate serious question rather than and I think this stems from the fact that women who are pregnant are recommended not to have it, or are recommended not to get pregnant within 2 months of getting it. And the only reason for that is because we don't know what the vaccine will do to a developing fetus. And it's out of that lovely American phrase, an abundance of caution. For the same way that you wouldn't prescribe nicotine replacement therapy in some circumstances to pregnant women at certain ages of pregnancy. So it's really just to protect the developing child in the womb. But there's absolutely no evidence it causes infertility. In fact, quite the opposite. There's more evidence that COVID causes erectile dysfunction in young men than there is evidence for infertility in this.
Thank you. Question 29, we know that members of the person's household won't be promoted. They will just have to at the moment wait their time. Extremely vulnerable over 60s. I think you were talking about Easter time.
Yeah, so group 6.
Yeah. Someone of 33 with a learning disability. Who does get the annual flu vaccine due to learning disability. This varies for both over 60.
I think it will be age and vulnerability. So he will probably be group 7, possibly lower than that.
Okay, thank you. Again, we know that people can't be vaccinated at the same time under current plans. So in this case, the husband who's clinically vulnerable would be prioritised. The wife would have to wait until she came into the right age group. Yep. This one's a bit more complicated. Suggesting all travelling care workers, and I think you said social care workers travelling to and from homes will be within the social care priority group.
Yeah.
I think that will be very reassuring, and the questioner will be interested in your comments on that.
So I think we absolutely have to protect social care. My mother gets a home carer. So it is great that home carers who travel will be in that list, because they can be vulnerable to the virus because of all the people they're seeing, as well as they can potentially spread it like anybody traveling around. So I think this is brilliant, and I think it's great that care workers are in priority group 2 personally.
Thank you for that. Accessible locations, how are we going to get there? We had this recently with an elderly lady who was partially sighted being invited to Lister and being quite worried to go late in the day because it would be so dark and she wouldn't be able to find her way back to the bus stop. She actually took a taxi in the end. But have we any view on how accessible the locations are, or is it just a question of identifying locations across the county?
So I think, yeah, so I think they're trying to do a mixture. So I think they've tried their best. I think it's been very difficult to identify locations. So it's been a mammoth test from people. I think they've tried to locate them in as close to areas as possible. So I think we have got them in where your GP practices are, and some are in GP practices, some are in, I know one's in a former nightclub. So we've kind of got lots of different venues. I think accessibility has come into it. I'm not going to say it's perhaps as accessible as your doctor's surgery, but they are trying to do that, and it will depend on where you live and what suitable locations they've been able to find. I appreciate some people have been asked to go to Lister Hospital, but they are rolling them out into your local areas as well to help. I don't know, Jim, is there anything else you want to add?
No, I think that's fine for me.
And I think the final question, I think you said that the Pfizer vaccination doesn't contain the live virus.
It's genetically synthetic.
Yes, thank you. 35, I think you've answered already. 18, who's clinically vulnerable. Again, quite a long way down the list from the sound of it.
Yeah.
Housebound one you've referred to. This is work in progress at the moment with the GPs. Concern about the success rate with lateral, or the reliability of lateral flow tests. Any comment on that?
So I guess and Tom and Anna may wish to comment on this as well, but what we know about lateral flow tests is that they do have some use and they can be valuable. And actually, if we get the training and things right, we can get a much higher level of sensitivity, i.e. picking up positive tests than 50%. We can get it up to 80% and higher in some cases in settings. And actually, we can do the same to improve the higher viral load. These things are not perfect. And so if you're going into a visit, you will still have to wear PPE. But the benefit of these is that they will pick up some people. Because at the minute, the situation you've got is if you go into a care home to visit, you can't touch at all, you know, even with PPE, and you're kind of in the blind, you're almost kind of, it's a bit like playing battleships, you don't know what you're aiming at, whereas with these tests, that will improve that significantly. It's not a magic bullet, but then there's no such thing as a test that gives 100% accuracy on anything.
I think, Jim, it goes back to your analogy of the Swiss cheese. What the lateral flow testing does is it's not an either or, it's an added layer of protection. And the real benefit, I think, that we're all hoping for is that the lateral flow testing, when carried out properly and where care homes are confident and competent to do so, to use it, it will enable visits of family to go see their loved ones. And for many, as has been pointed out in some of the chat, that's been something that's been really impinged for many, many months. And that's been incredibly difficult and challenging, not only for the individuals in those care homes, but also for the families who are desperate to see them. So it's another layer, and it's something that we, rather than sanction it, I don't think that's the right word, but Hertfordshire has taken the view that we are in support of the lateral flow testing as an added tool in order to open up the care homes to visits.
Thank you. I think we've answered that one, really. 70, I mean, I'm guessing it's going to be a 70-year-olds wants the 80-year-olds who have been dealt with, really.
Yeah.
So we're looking into February time, perhaps, something like that.
Around about that, I'm guessing. I mean, that's assuming we get the right. One of the things we do know about mass vaccination and mass treatment, because I was in Birmingham as Director of Public Health when we had the flu pandemic in 2009, which in no way was as bad as this. But what we found is that once that the kind of mass treatment centres and the vaccination centres a year after were up and running for about 3 or 4 months, the speed with which they moved just doubled. I mean, there were, you know, we did a vaccination exercise earlier this year where we were getting, and it was a drive-in, and we had a carload every 4 minutes by the end of it. So the speed will increase, but my guess is probably February.
And we know that actually carers can't assume they'll have the vaccination at the same time. In response to this one, again, I think you're saying there are no plans to prioritise family members or carers or the rest of the household, but perhaps this will be ammunition and evidence for the lobby.
Yeah.
Yes, so this is a question here about how is this very elderly person going to get to the Lister Hospital with the very elderly husband who doesn't drive.
I think if we need to, so I chair a thing called the Health Protection Board, and one of the things that the Health Protection Board does is it's responsible for the local outbreak management plan, and we have a grant from government for the management of the pandemic. So if people tell me there is a need to look at assisted transport, then, and I mean, Tom and Anna may know that may know more, may think adult care may be looking at already, but if there's a need for assisted transport, then I'm happy to go away and look at what we need to do in terms of assisted transport to see whether we can get transport to take people for their vaccines. And I don't think, we haven't got any plans about that, have we, that I'm aware of?
I'm not aware. There is a transport group that's been established, but I'm not aware of any work that's ongoing in terms of people living in their own home going to Lister. So it may be something we do need to look at. It's something we can take back through the transport group and see if they do need some resource on that. But yeah, certainly something we could look at, and whether I guess the other question is whether Lister is still the most appropriate place. So that's probably another conversation to have. But yeah, let's take that away and see what we can do to support people to get to these sites.
Thank you very
Right.
much.
We'll make a note of that and we'll take it up.
And a query here, if people vaccinated against the coronavirus become symptomless, will they become symptomless spreaders when they integrate back into the community?
They shouldn't do. There is still some debate about whether this vaccine just stops you getting ill or whether the vaccine stops you spreading it as well. But if you don't have COVID and get vaccinated, you won't be able to spread COVID because you haven't been given the virus. It's not like polio vaccine, where once you've had polio vaccine, you can actually shed live infectious virus in some cases. So the answer is no there. The issue will be, so you won't become spreaders if you're vaccinated and are not infected, no.
Right, thank you. With the 83-year-old disabled housebound lady, I'm guessing she's going to be part of the first priority list and the care staff part of the second priority list, and relatives not as yet on a priority list at all. I'm not sure what the planned programme is for Tring or what will be happening in Dacorum. Where would we find out? I'm not expecting you to know, but where could we find out?
So the first time for over 80, your PCN will probably, so your GP practice will probably be in touch as the first. I would imagine that'd be the first group. So you may already have been in touch since you've written these questions in, but if not, I'm sure they'll be maybe in the next wave. So your GP practice will be in touch, or alternatively, there may be other people may in touch, but you'll have a phone call inviting you to have a vaccine. So there's no need for you to phone the practice. You will have a phone call to invite you to have the vaccine.
Thank you. Again, we know carers are not going to be given priority despite heavy caring roles. This is a difficult one, really. This is a lady here of 77. Will she be able to have the vaccine before next February so that she is safe to help the rest of her family? I think you said 80-year-olds perhaps by February, so it might not be possible.
Well, 80-year-olds now, and then everybody 75 are in group 3. So with a bit of luck, fingers crossed, hopefully she will be.
That's a concise answer. That's what the ladies asked for. So yes, it looks possible actually in that case, which would be good. Any comments on this? Targeted chemotherapy, impaired immune system. Will the Pfizer vaccine be suitable for her, or will she have to wait for an antibody vaccination?
So if she's on permanent targeted chemotherapy, she should be under the care of an oncologist or perhaps a hematologist if it's a blood cancer. So I think some people with impaired immune systems can have it and some people don't. So that needs to go and have a discussion with you know the clinical team, because without knowing the exact details, I can't say.
So that would be the best place to go. Yeah. I think we know on this one, if the lady's going to be 80 this month, then actually on her age, she ought to be getting priority. Not sadly because she's a carer, but because on her age alone, she ought to be in the first wave.
Yeah, if she's 80, she should be in that first group.
I think she's not quite 80 yet. I think that's probably part of a bit of a GP pulling off a list and the name's not arriving on that list. So it sounds as if they've pulled a list and she's not. I'm assuming she's 79 at this rate, which is why she's not on the list. But it might be worth talking to your GP practice and explaining that and seeing if they can do anything with that. But I believe that will be why she's not on that list and why she's been told they'll contact her.
And if she's seeing a GP practice anyway, it's not a bad idea to say, I'm 80 this month, you know. Hint.
Yes, thank you.
I don't want
and happy birthday for this individual who's turning 80. Happy birthday.
Yes, indeed.
Absolutely.
Now, again, we know here, unfortunately, the carer will not be able to have a jab or have the vaccination at the same time as his wife. She'll be prioritised because she's in a nursing home. He won't because he isn't. And so he won't be opting to have the second dose. But I mean, there might be the opportunity, if the lateral testing is going through for him, to be able to see her more easily than at present.
Yeah, that's what we would hope. And I guess it's about that touch. So that's the thing that will enable us to do that because of the touch. Yeah.
Thank you. Yes, the rollout of vaccines is age related. Primarily, is it not? I mean, you know, it's age related primarily.
And it's a blunt instrument.
Yep.
Do anything by age, it really is a blunt instrument.
Yeah. Yes, that is very disappointing for people, I think, probably. Is it fair, if it is indeed the case, to roll this out purely on an age basis, and should the extremely vulnerable not be included? And I think you're saying that's a matter for ongoing discussion with government, really, or the Department of Health.
Yeah.
How is it going to be delivered, and what's the time frame? I think we've been talking about that a bit already. It's going to be delivered in 22 centres across the county, and the time frame is well into beyond Easter for quite a lot of people.
Yeah.
This is one probably for you, Jim, really. Extremely vulnerable, a severe allergic reaction to Cetrin, not allowed to put the vaccine. Is it likely that the AstraZeneca vaccine will be more suited to people with allergies of that sort?
I think what will happen is they may come back when they know more about the allergies of that. They're being precautionary because this is a brand new vaccine. So you will find either one of three things: either he won't be able to have it at all, in which case he may have to wait for antibody therapy, or he will be one of those people who can't have it and the rest of us get vaccinated to protect him from it. Or actually they'll come back to him and say, yeah, we've decided it's safe now, or it's safe for you to have AstraZeneca. But either way, there's an awful lot of people across the county. There's about 25,000 people, I reckon, who are in that boat of that kind of category, who just need to keep on taking all the precautions, and we need to keep on, because at the minute they can't have the vaccine. It's not great, but sadly that's where we are.
And the last question was one I asked you a bit earlier, really. With home care workers or domiciliary care workers, you confirmed they would be in priority category 2. Thank you. That actually takes us to the end of our questions with 2 minutes to spare. I know you've been picking up some of the stuff in the chat, which I haven't been able to look at. I don't know if there was any burning stuff in the chat you want to comment on before we come to the end of our session.
I mean, happy to answer anything in writing that we haven't picked up. I can't see anything massively burning that we haven't answered, but I don't know if Tom or Anna or Roma, you can, or any colleagues can.
Roma, there was something that sort of come out from a couple of entries in the chat, if I can maybe briefly pick up on those.
Please do.
We seem to say throughout the discussion that somebody's getting direct payments, paying somebody, to come in and provide a service, that the direct payments carer would be able to get tested. I think that was said in the chat. And then a follow-on question from that was, if somebody isn't eligible for direct payments because they don't meet the financial criteria, so they're having to pay the carer to come in and pay for it all themselves, would that carer then not be able to get tested? That was the sort of the gist of the question,
really. I think the issue will be about how we identify that they are paid carers, and if you are, I think the definition, there's a thing called the Green Book, and the Green Book says, which is the vaccine book, defines health and social care worker as somebody delivering frontline health and social care work. And normally it asks you for an ID card or something. So the issue of private workers is always a bit dodgy in terms of very, very unclear. So I think if you are a private paid carer and you are doing care work, contact your GP and say, by the way, I'm a carer. I don't know if Tom or Anna would agree with that.
Sorry, Jim, I was typing a response to another question.
Yeah, good man, good man.
Did you hear what I was rambling on about, Tom? Which is
I didn't.
Oh, right.
I can't
So
multitask.
if you're a private paid carer, so which a lot of people are, the arrangement for flu is you go to your GP and say I'm a social carer.
Yeah, you would be classed as a in fact you get more as a privately paid carer under direct payments, you would be eligible for a free flu vaccination. And as I understand it, that paid carers under direct payments will be treated as a priority two under the broader social care workforce.
The question though was direct payments are means tested, and if therefore you're having to pay, somebody's having to pay themselves because they can't get a direct payment because they don't meet that financial criteria, can the carer still get tested? Still get vaccine?
If they are paid, if they are in a caring, if they're being paid to be a carer, they will fall under the social care bracket.
Yeah. Okay. So if they're in paid care work, whether it's direct payments, whether it's fully funded by the person who pays them, they are a paid care worker. Whether they're employed by an agency, they are a paid care worker in the social care industry, and they should be eligible.
90% of people employed in social care are paid for in a private capacity.
Yes, indeed. Yes, indeed.
I think there is guidance about how that will operate in terms of a letter or something. So we will work that through as the guidance comes to ensure that anybody can turn up and prove that they are a carer. I think there's some of that logistics still to work through, but we are working that through as things get released from government to support that.
Well, thank you very much. I realise there's some other questions in the chat that we haven't had the time to go through, but I think, Jim, you kindly said you would be willing to look at these if we save them and send them to you, so that you will provide answers so we can share them with everyone present here today. Thank you very much for giving up your time, because I am sure that with the tier 3 lurking behind us, you are an extremely busy person at the moment. I know Tom has been up to his eyes in trying to improve things in the care homes. And obviously Anna is also working in very much this area. So we're very grateful for you giving up your time in the evening to come and speak to us. As I said, this is going to be recorded. If we get it downloaded appropriately or properly, it will be shared with carers who couldn't come today and with colleagues who couldn't come today as well. So thank you very, very much for your time. And thank you for the 60 odd, 50 odd carers who came along this evening and who've had to be mute and have had to just listen and rely on the chat function to say what they want to say. I know how difficult that is. So thank you very much for your patience in cooperating with that. Thank you.
Massive thanks to you all, to everybody, to Roma, Anna, Tom, and to all of you for giving up your time this evening. I'm very grateful. Thank you so much, and stay safe and happy Christmas, and we'll hopefully meet on the other side of this.
Thank you. Thank you. Cheerio.